Bismillahirrahmanirrahim. Now, starting with Giardia. Giardia is the parasite which causes giardiasis. Now, this is the trophozoid of Giardia. The life cycle of Giardia basically consists of a cyst and a trophozoid. So, this is the trophozoid. The trophozoid has two nuclei and four pairs of flagella. One, two, three, and this one is the fourth flagella. And it has a suction disc over here which attaches to the intestinal wall of the human. And then comes the cyst of Giardia. This is the cyst of Giardia, and the cyst consists of four nuclei: one, two, three, four nuclei, and there are some internal fibers also. Now, in the pathogenesis of Giardia, what happens that the food and the water is contaminated with the cyst, and the cysts are ingested. They are contaminated by the feces of the infected person, and the person may show the symptoms, or the person may be asymptomatic. Then, when the cysts in the food are ingested, these are the cysts. When they are ingested, then what happens that the cysts enter the duodenum, and in the duodenum they attach to the gut wall, but they do not invade the mucosa. In the previous entamoeba histolytica, we have seen that entamoeba histolytica invades the mucus, but it does not. Giardia does not invade the mucus. It does not enter to the blood, but it causes the inflammation of the mucosa. It causes the inflammation of the mucosa, but does not invade it, and hence it will cause malabsorption of fat and protein. Fat and protein will be less absorbed or will not be absorbed at all. So the cyst can in the food cannot be killed by chlorination, but they can be killed by filtration. Cysts can be killed by filtration, and the risk is higher in the hikers. Hikers basically drink the water of the stream water, so they have a higher risk of developing giardia, and the children in the daycare centers and the people in the mental hospital. The clinical findings and the signs and symptoms consist of the watery but non-bloody diarrhea and foul smelling diarrhea. There is nausea, anorexia, flatulence, abdominal cramps, and these signs and symptoms persist for weeks or months, but there is no sign of fever. So now the laboratory diagnosis consists of the microscopic examination of the stools, which consist of trophozoites as well as cysts in the diarrheal stool. In the diarrheal stool, both trophozoites and cysts are present, but in the asymptomatic carriers, the carriers which do not show symptoms, only cysts are seen. And there is another test which is enzyme linked immunosorbent assay test, ELISA test, that detects giardia antigen in the stool. Basically, it is the test for the antigen of giardia. And if all these tests are negative, then what happens that another test is performed, which is a string test. In this, what happens that if there a string is inserted into the mouth, and then it goes into the gut and deeper into the duodenum, stomach, then duodenum, etc. And what happens that here the trophozoites and the cyst will attach to the string, and when the string is taken out, then it will have, if giardia is present, then it will have cyst and trophozoite on it.